Hi, my name is Dr. Stephen Flamm. I'm the Director of Liver Transplantation Outreach and the Director of Clinical Research at Rush University Medical School in Chicago. I'd like to welcome you to today's podcast. I'm going to talk to you about an independent perspective of a physician's look at the obeticholic acid experience. Upon the soon removal of OCA from the clinical market, it gave me pause to consider what the OCA experience has been for we clinicians over the years. OCA was the first second-line therapy ever approved for treatment for patients who have primary biliary cholangitis, an incurable disease, who are not having an optimal response to ursodeoxycholic acid. We learned from this that we could benefit patients dramatically. I have had over the years many patients on obeticholic acid. They derived, in my opinion, clinical benefit that has been demonstrated in trials, but also in my personal experience. In fact, I had a patient today that's been maintained on OCA since it was approved in 2016. And he recently switched to elafibranor, but he's actually in the pharmacy field. He heard about the removal of OCA from the market and told me today, he said, I am so happy that this product was available for me because I am convinced that over all these years, it delayed the progression of my disease, and I still feel very well and can move forward in my life. As far as a tolerability standpoint, I personally never had any tolerability issues with OCA, with the exception on occasion of self-limited pruritus. I found the drug easy to give and beneficial to patients from very many different clinical standpoints. And I think I'm sad that, that will be removed from the market. But, we don't always control everything that we want to control. And fortunately for patients, they have two new options for second-line therapy that they can transition to from obeticholic acid. One, elafibranor, as I briefly mentioned earlier, and the second, seladelpar. And I will be in the next weeks transitioning my patients from obeticholic acid to one of the new medications, elafibranor or seladelpar. Keep in mind that obeticholic acid will be removed from the market, as I understand it, in November 2025. So you should have a plan for how to transition your patients that are on obeticholic acid to one of the other newer second-line therapies. So again, it is with a heavy heart that I bid adieu to obeticholic acid. I think it played a critical role in the evolution of therapy of primary biliary cholangitis, and also because of the efforts of Intercept, the company that manufactured obeticholic acid. We've had the opportunity to educate so many healthcare providers throughout the country on primary biliary cholangitis so that they were able to benefit patients and optimize clinical outcomes that will be realized for years to come. I'd like to thank you for attending today's podcast.